I must say, it's the CLL that really is making the moves at ASH this year. It's tremendously exciting. There are 3 oral sessions dedicated to new therapies in CLL. So that's 4.5 hours of CLL abstracts, which is great. It's hard to pick between them as to what's the most exciting. I think the data with venetoclax is really great. So this drug, it's a whole new way of treating cancers. It targets the apoptosis, that's the killing mechanism of cells, with this very clever molecular switch. And the data in CLL is looking really, really good. There's data as monotherapy in the relapse setting. There's data combined with antibodies, both rituximab and obinutuzumab. There's data with this drug combined with chemotherapy. And across the board, it's just looking good. Its toxicity profile is good. There were problems before with tumor lysis, before the researchers really worked out how to use the drug, but now with dose escalation schedules, the toxicity is very manageable and the results are looking very promising. And it's hard to pick between them, but it's great. So it's not just that drug, venetoclax, it's the BTK inhibitors are looking good. There was ibrutinib data up front in the first large randomized trial up front in the frail population against chlorambucil. Yeah, well, perhaps chlorambucil isn't the toughest opposition for ibrutinib, but still impressive. Some headline figures to take away. 87% of patients still on ibrutinib at 17 months. An acceptable toxicity profile, some readout with hypertension, atrial fibrillation and bleeding, and we need to explore those a bit more, but generally very good overall survivals and good compliance and retention of medication. But it's not just ibrutinib, of course, there are other BTK inhibitors now. The Acerta drug is looking very, very promising, and that's going through trial in the relapsed refractory setting, and the trial program for the ACP-196 is expanding. The Chinese have got their BTK inhibitor presenting data as well, so there's that. It's good stuff. And there's, well, you can carry on. There's also data on a number of PI3 kinase inhibitors, and actually that's a bit of a caution, a note of caution. There's been some review of the toxicity data using one of these drugs, idelalisib, up front, and it's quite interesting getting a contrast in toxicity between first line and second line, and I think it just reminds us how complicated the immune system can be. So that's definitely a watch this space.